There are three types of mouth ulcers, the common ones. These are minor aphthous ulcer, major aphthous ulcer, herpetiform ulcers. Other than these three, there are so many diseases, systemic conditions, diseases, which one of the complaints can be mouth ulcers. So when I said the common three types, minor aphthous ulcer, major aphthous ulcer, and herpetiform ulcer, it involves only the oral cavity. There is no systemic involvement at all. So in this video, I'm going to talk mainly about major aphthous ulcer. It is called as major aphthous ulcer. Since this is a patient teaching program, I have added up the word mouth ulcer so that they can understand better. Now, the three common types, minor aphthous and the major aphthous. I'll tell you the difference between these two also. The major aphthous ulcer, the cause for this is not known. You have an ulcer in the oral cavity which is more than 1 centimeter, and it commonly starts after the age group of 20, that is puberty, 20 to 40, more common in females, and it starts by puberty. I have already mentioned. Age group also I have mentioned. Now, coming to the difference between minor aphthous ulcer and major aphthous ulcer. Minor aphthous ulcer, the size will be less than 1 centimeter, usually 2 to 3 millimeters only, and it will be multiple. The major aphthous ulcer, you will have 1 or 2 only. The size will be more than 1 centimeter. So the difference between minor and major, it's mainly the size. Both of them, it is painful. Coming to the third variety, which is called as the herpetiform ulceration, which results because of a specific virus called herpes simplex virus. You have multiple small ulcers, small one, more than 10. So these are the three common type of mouth ulcers. So coming back to the topic, major aphthous ulcer, the cause of this is not known, and the common presentation, they'll say they're not able to eat properly and they're not able to speak properly, but they have a muffled voice. If they ask the reason why you don't not able to eat properly, they'll show us the ulcer. Because of that, they are not able to eat properly. And some of them, they may have fever and they'll be tired also. So on examination, as you see in this picture, there'll be a big ulcer about approximately more than 1 centimeter. Just 1 or 2 only. It will be painful. It will have a white or yellowish center point surrounded by a red halo, and it is painful. That is the usual presentation. Now, the normal progress of this condition, the aphthous ulcer, the major aphthous ulcer, by routine, it takes 1 month. Usually, it takes maximum of 1 month to heal. It has got its own course. And once it heals, it leaves behind a scar. We don't need any specific investigation to diagnose this, because the ulceration is confined to the oral cavity and there is no systemic involvement, no complaints associated with that except for the ulcer. So it's a clinical diagnosis. We don't need any specific investigation to diagnose this. So coming to the treatment. So patient, he faces two problems. One, he is not able to eat and he has got a muffled voice. And after breakfast time, lunch or dinner, in between interval time, they have this discomfort in the oral cavity. So these are the main two problems which we need to solve. So the treatment, let me start by telling you that most of the patients, they have the habit of mingling with the ulcer with the tongue. They keep on rubbing the ulcer with the tongue. So this delays healing. The first thing to be done is you have to stop that. Second is spicy foods, hot drinks, let it be coffee or tea or hot chocolate. All this, it can aggravate. Even smoking can, alcohol can, and dehydration can. So all these has to be avoided. So you will be advised to take blank balanced diet, and you have to drink a lot of water, plenty of water. You have to keep yourself hydrated. So because of the pain, most of them, they are not able to eat stomach full. So my advice will be, instead of 3 times daily, you take more frequently, 5 times daily, little quantity but 5 times daily, and drink plenty of water. So when you take spicy food or hard foods, when it comes in contact, then you will not be able to eat. So balanced food, blank food without spice, this is going to help you. And this diet you have to continue for 1 month. That is for the pain while swallowing. This will take care of that. Now you have the next problem, that is after breakfast, lunch or dinner, you have the discomfort. How to solve that? For that, let me start with home remedies. What all you can do at home to keep yourself comfortable, because you have to face this problem for 1 month or approximately 1 month, 4 weeks to 6 weeks. So how can we make you comfortable? So I'll tell you at least some 15 to 20 home remedies. You choose any one of these and see which is suitable for you, and you continue this for 1 month. Let me start with honey. It has to be organic honey, and this you apply over the ulcer. And any one method which I am going to tell you, you are supposed to apply or drink or gargle, and after that, if you gargle, you have to gargle at least for 30 seconds, at least 2 times, and after the procedure, you are not supposed to drink or eat or drink for next 2-3 hours, so that you get the effect of what you have taken. So honey you can apply directly, or salt water gargle, or baking soda or baking powder gargle. Baking soda will be better. So the preparation, if you ask me, for the baking soda, 1 glass of water, teaspoon, not the tablespoon, teaspoon, half teaspoon baking soda will be enough. With that you can gargle 2 or 3 times. If it is salt water gargle, it will be 1 glass of water, 1 tablespoon of salt, non-iodized salt, or you can use rock salt, pink salt, or Himalayan salt. Why I am saying non-iodized? Because iodized salt, maybe it can irritate the ulcer, so you'll find some discomfort. That's why. The other solutions are, other remedies are pure coconut oil that you can apply at least 3 or 4 times daily, or you'll get olive oil in the market. So you apply on the cotton, and that cotton you apply over the ulcer and leave it that for few hours. Applying ice cube over the ulcer, it gives very good relief, excellent relief, but it lasts only for approximately 20 seconds, it fades off. Now you have the other remedies, like you can gargle with coconut milk. Then you have turmeric, you can make a turmeric paste, or you can make a gargle, prepare a gargle. I'll tell you how to prepare a gargle. Same like salt solution, but the quantity I'll tell you. 1 glass of water with half teaspoon of, or more than a pinch of, half teaspoon of turmeric powder. The turmeric powder has to be prepared at home, not what you get in the market for making curries, because those it will contain ingredients. That's why it can produce some burning sensation. Next will be orange juice is good. Likewise, alum powder can be prepared and applied for 5-10 minutes, and you do saline gargle. Yogurt per day at least once, it is good. Likewise, cabbage, either you can apply a paste, or you can make a juice, or you can do gargle. Now if you are using apple cider vinegar or hydrogen peroxide, you need to dilute it 1:1 for gargling. Then you have magnesium, milk of magnesia, which you can apply as a paste, leave it for 5 or 10 minutes, and you do saline gargle. Likewise, aloe vera juice is also very good. Garlic, 1 garlic you can chew and take it in, you can swallow it. And the last one, at least weekly 3 times you can chew tulsi leaves. These are very good. So these are the home remedies. You choose any one of them and see which is good for you. This is going to make you a little comfortable. for a period of 1 month till the ulcer goes off. Now, the commercially available ones. Most of us doctors, we used to prescribe either Bicosules or B complex with zinc, or it will be a multivitamin tablet for a period of 7 to 10 days. There are some pastes which are available which gives very good relief, like how I mentioned here. It gives very good relief. It anesthetizes the whole area, but usually I reserve it for some patients, because this paste, it anesthetizes the area, it gives very good relief, and suppose they start taking spicy food or hard food, it irritates the ulcer, then it prolongs the healing period. That's why usually I don't advise for all the patients. I reserve it for like some professionals like teachers, headmistress, they have meeting, they need to talk with somebody. So at that particular occasion, I tell them, please use it for that particular occasion, then try to avoid it. So I have mentioned both home remedy as well as some medication which is commercially available. Now, what all things to be avoided, I have already mentioned. And you have to change your toothbrush every 3 months. If you are not done recently, please do it. Because even if you have a soft bristle one, but with a duration of 2 to 3 months, it becomes hard. And the paste, take a mild one, not a strong one. So my aim is to make you comfortable. There is no single remedy to be taken for Aphthous ulcer which reduces all the complaints and it fades off by, say, 4-5 days. You have to bear with it for 4 to 6 weeks. So during this 4 to 6 weeks, I have to make you comfortable. So these are the different techniques to make you feel better. Thank you so much.